Hello, my name is Ružica. So today we are gonna talk about the real effect of narcissistic parenting on children. Why does it matter if a parent is a narcissist? How does that hurt a child? You may be asking this question if you are a parent co-parenting with a narcissist ex, someone raised by a narcissist parent, one who is in relationship with a narcissist, or maybe a divorced professional working on a case that involves a narcissist parent. Given me research and clinical experience, I want to provide some education and awareness about how this disorder hurts children. First, let me explain that narcissist personality disorder is most understood when applied to someone who is just boastful, arrogant, and all about themselves. While those traits are annoying and not fun to be around, narcissist is a deeper, more destructive disorder that has devastating effect on the people in relationship with the individual. It's a difficult disorder to treat. Some believe it's untreatable. So how does narcissist parent affect children? The child won't feel heard or seen. The child's feelings or reality will not be acknowledged. The child will be treated like an accessory to the parent rather than a person. The child will be more valued for what they do, usually for the parent, than who they are as a person. The child will not learn to identify or trust their own feelings and will grow up with crippling self-doubt. The child will be taught that how they look is more important than how they feel. The child will be fearful of being real and will instead be taught that image is more important than authenticity. The child will be taught to keep secret to protect the parent and the family. The child will not be encouraged to develop their own sense of self. The child will be feel emotionally empty and not nurtured. The child will learn not to trust others. The child will feel used and manipulated. The child will be there for the parent rather than the other way around as it should be. The child's emotional development will be stunted. The child will feel criticized and judged rather than accepted and loved. The child will grow frustrated trying to seek love, approval, and attention to no avail. The child will grow up feeling not good enough. The child will not have a role model for healthy emotional connections. The child will not learn appropriate boundaries for relationship. The child will not learn healthy self-care, but instead will be at risk of becoming codependent, taking care of others to the exclusion of taking care of self. The child will have difficulty with the necessary individualization from the parent as he or she grows older. The child will be taught to seek external validation versus internal validation. The child will get a mixed and crazy making messages of do feel to make me proud as an extension of the parent, but don't do too well and outshine me. The child is outshining the parent, may experience jealousy from the parent. The child is not taught to give credit to self when deserved. The child will ultimately suffer from some level of post-traumatic stress disorder, depression, or anxiety in adulthood. The child will grow up believing he or she is unworthy and unlovable because if my parent can't love me, who will? The child is often shamed and humiliated by a narcissist parent and will grow up with poor self-esteem. The child often will become either a high achievement of a self-saboteur or both. The child will need trauma recovery and will have to reparent themselves in adulthood. So being raised by a narcissist parent is emotionally and psychologically abusive and causes debilitating, long-lasting effect to children. Is it often missed by professionals because narcissists can be charming in their presentations, displaying an image of how they wish to be seen, behind closed doors. The children feel the suffocation and struggle with loneliness and pain. The narcissist is not accountable for their own mistakes or behavior, so the child believes they are to blame and that they flunked childhood. Having worked as a mental health provider with thousands of children as well as the adult children of narcissistic parents, I see the above symptoms again and again. The lifestyle differ and the stories differ, but they are all with the same emotionally banners. It's quite a list. It takes serious recovery work to get better and feel better. If you are the other parent or part of the extended family and are trying to ward off the effect of narcissistic parent, you will have dubbed duty as the responsible one. The best approach is to parent with empathy. So if you are a divorced professional working with a case that involves a narcissist, help the kids by first really understanding the dynamic of this disorder. Don't minimize it. Make sure the children are in therapy and are learning skills to use with a parent who does not emotionally tune into them. Put the kids first. So narcissist is a spectrum disorder, so think of it as a condition ranging from low-level traits that we all have to some degree to a full-blown personality disorder. The higher level of traits, the more damage gets done to children. So I personally think that that's long term to fix a narcissist, even if that's possible. So maybe therapy work a little bit, but not that much. And the people who are near the narcissist are suffering for all their life because they think if they leave, they are not gonna be able to provide something, to be loved and that kind of stuff. So we are here to talk with you, to chat with you, to help you feel better. So we are organizing now talking sessions, and we are here for you. And my name is Rožica, so stay healthy and chat with us if you need to, and that's all. Bye.